Welcome to Group 10's presentation on chronic exposure to organophosphate pesticides and its health effects in agricultural workers in the United States. Let's first start with general information about these pesticides, their history and use, as well as information regarding exposure. Organophosphates, or OPs, are a class of pesticides that are highly toxic. As of 2013, there were 36 OP pesticides registered for use. Examples of OP pesticides include parathion, chlorpyrifos, and diazinon. Presently, OPs are used in agriculture and personal gardens. They work as insecticides by inhibiting acetylcholinesterase, an enzyme that breaks down neurotransmitters, which leads to insect death. Direct exposure occurs in agricultural workers who personally apply pesticides and results in the highest levels of exposures. Pesticides can be absorbed through the skin by ingestion during spraying as well as through inhalation. The level of direct exposure is influenced by how the pesticide application is conducted. Spills also contribute to an individual's direct exposure to pesticides. Indirect exposure is more likely to represent long-term, low-level exposures. Indirect exposure occurs most through drinking water, air, dust, and food. The toxicity of OPs has been known since 1932 when German chemist Willy Lang and his assistant Gerda von Kruger tested OPs on themselves. Gerhard Schrader, a chemist for the Bayer Corporation in Germany, was inspired by this research and began exploring OPs as insecticides in the 1930s. However, in 1936, the German military recognized the potential of these pesticides as weapons and put Schrader in charge of developing OP nerve agents for the Nazi effort. Following the war, American scientists gained access to Schrader's lab. They used his work to develop pesticides, eventually developing the OP parathion. Once other pesticides were banned in the 1970s, some of the Schrader-derived pesticides gained popularity. Parathion was incredibly popular, but then was banned or restricted in 50 countries throughout the world due to its recognized toxicity. So how do health effects from OP exposure show up in the body, and how have agricultural workers specifically been impacted by these effects? There is a significant amount of literature on the acute toxic effects of OPs, but literature on the effects of chronic exposure, which is repeated episodes of exposure over the course of time, is lacking. Symptoms reported vary widely. These include respiratory symptoms such as chronic cough, phlegm, chest pain, runny nose, wheezing, shortness of breath, and throat irritation. Abdominal symptoms include pain, nausea, vomiting, and diarrhea. There have been several studies looking into the effects of the reproductive system of males. All have shown a decrease in semen quality, damage to the sperm, and changes in reproductive hormones. Other effects that have been reported from prolonged exposure to OPs are cardiovascular disease and cancers of the thyroid, breast, and ovaries. Several studies evaluating the neurological response to chronic exposure also found a variety of symptoms. These range from peripheral neuropathy to sensations in the skin, hands, and face. Additionally, there was a case study completed by Little et al. Of a woman who had chronic organophosphate-induced neuropsychiatric disorder. She had a resting tremor, unsteady gait when ambulating, a history of falls, and loss of balance. Symptoms that mimic Alzheimer's disease have also been recorded. Multiple studies have been done that specifically look at the health effects in agricultural workers. A study by Stallone et al. Found that farmers who were chronically exposed to OP pesticides suffered from neurological symptoms, including restlessness, memory issues, and difficulty interpreting the meaning of written materials. They also experienced irritability, depression, weekly headaches, and fine motor difficulty. Rollman et al. Conducted a study in Oregon comparing health effects, biomarkers of exposure, and neurobehavioral performance between current Hispanic adult and adolescent farm workers and those not working in agriculture. The results of this study found neurological impairment may be associated with increased years working in agriculture. There is also a growing body of research linking occupational exposure to pesticides, including OPs, to Parkinson's disease. However, authors Firestone et al. acknowledge the evidence regarding this association has been inconsistent and more research is needed. It is important to note that family members of agricultural workers can also be indirectly exposed to pesticides. Take the 12-year study focusing on the wives of farmers who mixed OPs for or applied OPs to their crops in Iowa and North Carolina. This study found that the spouses of these farmers had a significant risk of developing or being diagnosed with diabetes. This is relevant because certain types of OPs have been shown to increase the risk of developing diabetes in the persons handling and applying them. There are several limitations to consider when studying the effects of OPs. First, the number of pesticide exposures and resulting health effects could be underreported due to agricultural workers' fear of losing their jobs or because of their immigration status. The farm worker community is primarily low income and Hispanic, which brings about other challenges such as lack of resources and language barriers. Even when workers do seek care for exposure, the doctors who treat them often lack knowledge regarding pesticide exposure symptoms, and these symptoms have been misdiagnosed as bronchitis, asthma, and stomach flu. The health effects from chronic exposure are more difficult to track and linked to the original exposure. Additionally, it is less evident exactly how much exposure is necessary to result in long-term effects such as cancer, reproductive problems, and death. This is further complicated by hundreds of active ingredients in pesticides, along with different formulations of each product, and latency between exposure and clinically detectable effects. These factors contribute to scientific uncertainty and present a challenge when attempting to restrict the use of OP pesticides and establish causality. So what has been done to regulate OP use so far? The first piece of legislation in the United States on pesticides was the Insecticide Act of 1910, which focused on protecting farmers from economic exploitation, but did not address the health impacts of pesticides. That would not happen until the Federal Food, Drug, and Cosmetic Act of 1938 and the Federal Insecticide, Fungicide, and Rodenticide Act of 1947. FIFRA mandated that manufacturers register pesticides with the EPA and place warnings on the packaging of harmful pesticides. The Food Quality Protection Act of 1996 amended FIFRA along with the FFDCA by imposing new safety standards on pesticides used in food. After the FQPA passed, the EPA began reevaluating the health and environmental risks of existing pesticides. Because of their frequent use and high toxicity, OPs were chosen as the first group of pesticides to be reassessed by the EPA. To wrap up, we will now name some challenges as well as solutions regarding this issue. First, despite increasing concern over consumption safety and an increasingly strong consumer demand for organic food, pesticide use in the U.S. is on the rise. According to the United Nations Food and Agricultural Organization, pesticide use is expected to continue trending upward in the coming decades. Knowing this, regulation of pesticides must stay apace of this growth to meet the challenges of an expected rise in exposures. Additionally, using OPs are less expensive for farmers versus alternative methods. Opponents of pesticide regulation state that farmers who use pesticides make more money than those who do not. Regulation of OPs may continue to prove difficult if their use provides higher income for farmers and keeps produce affordable for consumers. There are several proposed solutions which could protect agricultural workers. First, a nationwide medical monitoring program for OP exposure should be strongly considered. According to Busby and Eckstein, if cost-benefit analysis of monitoring considered not only human health, but also the environmental gains, the benefits would far outweigh the cost. The current annual estimated total cost of health effects from pesticides in the U.S. is $786 million. It seems to be an option worth considering. Increasing agricultural workers' access to and proper use of personal protective equipment is a way to prevent exposure and protect workers. In a study by Gomes et al., Just wearing gloves reduced dermal exposure amount in U.S. citrus farmers by 27%. And if coveralls were also worn, the percentage of dermal exposure was reduced 65%. And lastly, the dangers that agricultural workers face does not receive much attention. The workers are typically out of sight, out of mind, and are not empowered to voice concerns individually or act collectively. Increased public education regarding the dangers posed to agricultural workers may have an impact on the visibility of these workers' plight, which could in turn have an impact on the conversation regarding our pesticide use. Encouraging workers to report exposures and seek health care is imperative to challenging power structures that keep agricultural workers subject to toxic harm. Empowering workers should be an effort in partnership with workers, community leaders, activists, research partners, and others. In conclusion, although most research shows evidence of an association between chronic OP exposure and health effects, it is critical to recognize that there are conflicting results across the research. Two separate systematic reviews conducted on chronic OP exposure and health effects found that while there is evidence of an association between chronic OP exposure, neuropsychological functioning, not only was there no consensus on the particular skills affected, but there was also too much variation in the testing and methods and measurement methods. Therefore, more research of chronic OP exposure and the resulting health effects is needed. Finally, agricultural workers are highly susceptible to chronic exposure to OPs and are not provided adequate protection or resources to guard against the associated health effects. The general public should be provided more education regarding the very real dangers faced by farm workers. Direct solutions, such as consistent PPE usage and medical monitoring, should also be strongly advocated for and considered. Thank you.